Hello, you are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, as I indicated last week, going forward, yes, we'll be bringing you all these anatomy of clinical importance in a form of case studies. And my friends, today's case study, yes, this is how it goes. A woman, yes, there's that kind of suspicion of a mole, yes, which is located, yes, on the what we call anterior border of the sternocleidomastoid. Now, this muscle that we find over here is the sternocleidomastoid muscle, just about 8 mid-length. Now, one thing is that, yes, which nerve will have to be anesthetized so that, of course, this woman, yes, goes through this procedure pain-free. Yeah, this is where we need to understand, yes, the cutaneous nerves which exit, yes, of course, the posterior, yes, triangle of the neck, yes, mainly I'm talking about the occipital triangle, yes, at the nerve point. Yes, that's one thing I want you to understand. So now, whenever you want to understand which cutaneous nerves exit the posterior triangle of the neck at the nerve point, then one thing that you have to understand is for you to know which muscle we are talking about. The muscle which is very important in demarcating the anterior triangles of the neck from, of course, the posterior triangle of the neck. And my friend, that muscle is this guy that we find over here, the sternocleidomastoid muscle. Now, before I come to the main question, and of course get you the answer to that effect, there is one thing that I want you to understand. Now, as far as the sternocleidomastoid muscle is concerned, in the posterior triangle of the neck, specifically in the occipital triangle, we'll be seeing a point that we call just about it midpoint. We have what we call the nerve point. Now, what it means is that whichever surgery that is going to be performed, as far as the triangles of the neck, especially the posterior triangle of the neck, then surgeons will have to be very mindful so that they don't cause injury to, of course, structures. Of course, we are talking about the nerves which exit, of course, the posterior triangle of the neck via the nerve point. This area becomes very important that we take care of it. Now, which nerves are exiting this nerve point? At this nerve point, my friend, there are 4. And what are these nerves? Now, the first one which we talk about is the one which runs along with the posterior, yes, it ascends upwards along the posterior border of the sternocleidomastoid muscle. And that nerve ascends upwards and, of course, goes to this occipital area. Okay, yes, by so doing, it will also supply what we call the upper 2 tiers of the medial aspect of the auricle. Okay, we'll be supplying it. And my friend, that nerve is what we call lesser occipital nerve. My friends, the root value of this lesser occipital nerve is, of course, C2. Okay, cervical nerve. Yes, it will be supplying the area of occipital area. Yes, together with, of course, the medial 2 tiers portion of what we call the auricle. Of the upper portion of the auricle. That's what we are talking about. Now, apart from that, yes, we will also be seeing another nerve. And my friend, this time around, that nerve, yes, what happens is that, yes, it also runs, it ascends upwards, but this time around, it runs on what we call the belly of what we call the sternocleidomastoid muscle. It also ascends upwards, and my friends, it comes all the way here and supplies what we call the skin over the angle of mandible. Of course, supply the skin over the parotid area, and of course, also supplies the skin of what we call the lower 1/3 portion of the auricle. I'm talking about the lobe of the ear. And my friend, that nerve is what we call great auricular nerve. And my friend, that great auricular nerve, yes, its root value is, of course, C2, C3. That's the root value. And one thing I want you to understand is that as that nerve ascends, it also moves along with one vein. And my friend, that vein is, of course, we're talking about what we call external jugular vein. So great auricular nerve, yes, runs with what we call external. It runs with what we call external jugular nerve. That's one thing I want you to understand. Now, the next nerve which we are talking about, yes, this time around, and I will come to that one because that's the last thing I will talk about. There's one more nerve, and that nerve exits and, of course, comes down. Yes, it comes into one of the spaces, yes, enclosed by what we call the investing layer of deep cervical fascia. My friend, I'm talking about what we call the supraclavicular space. And my friend, that nerve going there is therefore called supraclavicular nerve. Yes, it divides into 3 branches. Okay, supraclavicular nerve. Its root value is, of course, C3, C4. That nerve will be supplying the skin, yes, over what we call the supraclavicular space. Now, my friends, I'm not talking about that one because the description of this question was that, yes, the suspected mole or nevus, yes, is found, yes, along what we call the anterior border. I'm not talking about posterior border, okay? I'm talking about anterior border, just about 8 midway, 8 mid length. We are talking about anterior border of what we call sternocleidomastoid muscle. And so for us to ensure that this patient, yes, goes through this procedure, yes, uneventfully and of course pain-free, then what will happen is that we have to anesthetize, which nerve. And my friend, that's the nerve that I'm going to talk to you about. So there's another nerve which exits the nerve point at the posterior border of the sternocleidomastoid, but this one runs transversely across the belly of what we call the sternocleidomastoid muscle, and then comes anteriorly. Okay, so that nerve is what we call transverse cutaneous nerve of the neck, or transverse cervical, nerve. And my friend, the root value is of course C2, C3. So because it runs transversely and comes to the level of anterior border of the sternocleidomastoid muscle, yes, just about 8 mid length, then it means that that's the nerve that will have to be anesthetized for this patient to go through this procedure pain-free. My friends, I believe you understand all these clinical cases. Okay, going forward, we bring you most of these ones so that, of course, you can understand the clinical case in, of course, the clinical setting. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.